আমরা এর আগের দিনে JEPBN মানে পোস্ট বেসিক নার্সিংয়ের যে এন্ট্রান্স এক্সাম 2021-এর সেটার আগের কোয়েশ্চেনগুলো আলোচনা করেছিলাম। আজকে আমরা আবার 10 থেকে আলোচনা করব। হোয়াট ইজ দ্য রিলেশনশিপ অফ সোশিওলজি উইথ নার্সিং? অ্যান্সার হবে টু প্রোভাইড টোটাল পেশেন্ট কেয়ার। নেক্সট, reduction of pH of blood will answer হবে decrease affinity of hemoglobin with oxygen. Reduction of pH of blood will decrease affinity of hemoglobin with oxygen. Next, serum level of drug is monitored by a nurse when the patient is on. Answer হবে lithium. Lithium. The normal range of serum level of lithium drug is 0.6 to 1.2 milliequivalent per liter. Measurement of the serum lithium level should be carried out at least 6 to 12 hours after the last therapeutic dose to avoid the misinterpretation of pre-distributional level. Next, clear vision depends on refraction of light rays and size of pupils and accommodation. The refraction is the bending of light rays as they pass through one object to another. The cornea and the lens bend or refract light rays to focus them on retina. And the accommodation is the ability of the eye to change its focus from distant to near object and vice versa. The process is achieved by the lens changing its shape. Next, Mr. Sadhan Bishwas is admitted in ophthalmic ward with blurring of vision and is diagnosed as a case of glaucoma. Which of the following medications is contraindicated in the treatment of glaucoma? The answer is atropine sulfate. The answer is atropine sulfate. Contraindication in treatment of glaucoma is atropine sulfate. Atropine sulfate may raise intraocular pressure and precipitate an acute attack of closed-angle glaucoma. Atropine sulfate is contraindicated in the treatment of pyloric stenosis, thyrotoxicosis, fever, urinary tract obstruction and ileus 2. And pilocarpine is a cholinergic agonist. Pilocarpine is a cholinergic agonist. It is used as a medication to reduce pressure inside eye and treat dry mouth. Acetazolamide is diuretic medication that treats swelling caused by heart disease, and acetazolamide can also treat seizures, glaucoma and prevent symptoms of altitude sickness. And Xalatan is used in the treatment of high intraocular pressure in people with open angle glaucoma. Next, presence of pathogenic bacteria in blood is known as. Presence of pathogenic bacteria in blood is known as. The answer is septicemia. Presence of pathogenic bacteria in blood is septicemia. In septicemia, bacteria causes blood poisoning. Bacteremia is the presence of bacteria in blood. Bacteremia is the presence of bacteria in blood. And toxemia is blood poisoning by toxins from a local bacterial infection. And toxemia is presence of bacterial toxin in blood. And the presence of pathogenic bacteria in blood is septicemia. It causes blood poisoning. Next, vomiting center is situated in the medulla. What is the function of hypothalamus? What is the function of hypothalamus? The function is hormonal regulation, regulate heart rate, body temperature, hunger, sleep-wake cycle, and hemostasis. The function of hypothalamus is hormonal regulation, heart rate regulation, body temperature regulation, hunger, sleep-wake cycle regulation, and homeostasis regulation. The function of hypothalamus is homeostasis regulation. And amygdala is the function of amygdala is major processing center of emotion. Amygdala is the major processing center of emotion. And what is the function of pons? Pons relays sensory information to cerebellum. Pons connects forebrain to hindbrain. And pons regulates breathing, and pons involved in control of sleep cycles. So the vomiting center is situated in the medulla. The next questions will be discussed later.